Hello, my name is Juerd Wijntjes. I work as a neurologist and clinical neurophysiologist in the Radboud Medical Center in Nijmegen, the Netherlands. In this presentation, I will discuss the anatomy and scanning technique of the sciatic, femoral and saphenous nerve. Before I start, let me say that I've got nothing to declare. For each nerve reviewed, I will discuss the positioning of the patient, important anatomical landmarks, and finish with an instruction video. We will discuss the sciatic, femoral and saphenous nerve. Let's start with the sciatic nerve. For scanning the most proximal part of the sciatic nerve, the patient should be in prone position as shown in this picture. Here we see a dorsal view of the hip region. We can see the sciatic nerve over here. And on the opposite side. The most important landmarks are the ilium, the gluteus maximus muscle, and the piriformis muscle, and finally the sciatic notch at this location. For scanning this proximal part of the sciatic nerve, start scanning at the level of the ilium, then move the probe in caudal direction towards the piriformis muscle. Like this. The piriformis muscle will be the first muscle to lay underneath the gluteus maximus muscle. Confirmation of this muscle can be made by rotating the hip internally and externally with the knee flexed. Here we see the gluteus maximus muscle, and underneath is the piriformis muscle. Keep moving the probe in caudal direction and you will find the sciatic notch. The sciatic nerve can be found over here. For scanning the more distal part of the sciatic nerve, the patient should be in prone or lateral position, as shown in this picture. Now let's review our landmarks. Here we see a dorsal view of the upper leg. The sciatic nerve travels underneath the biceps femoris muscle. Over here. It travels along with the popliteal artery, and finally it will bifurcate into the tibial and fibular nerve. Here we see the popliteal artery, and this is the level of the bifurcation. In this instruction video, we see the ultrasound screen on the left and the probe position on the right. I start by locating the popliteal artery using color Doppler. We can find the sciatic nerve laying superficial to the artery and underneath the biceps femoris muscle. The muscle is well appreciated in longitudinal direction, and I will show that if I reach the most proximal part of this scanning area. So there's our sciatic nerve, and you can see all the time the biceps femoris muscle laying on top of it. And here I will try to make a longitudinal view of the sciatic nerve. And as you can see, the biceps femoris muscle is clearly seen on top of the sciatic nerve on its whole trajectory. If we follow the sciatic nerve in caudal direction again, we can find the last important landmark, namely the bifurcation into the fibular and into the fibular nerve and tibial nerve. There's our sciatic nerve. And here we see the bifurcation. So let's go on with the femoral nerve. The femoral nerve is best investigated with the patient in supine position, and you should be able to scan nearby the anterior superior iliac spine. Here we see a ventral view of the hip region. we can see the femoral nerve over here. The most important landmarks are the anterior superior iliac spine, located over here, and the femoral vein and artery and vein. And this can actually be quite easily remembered by the mnemonic VAN. So vein, artery, nerve, from medial to lateral. Vein, artery, nerve. Let's have a look at the instruction video. In this instruction video, I will start by locating the femoral artery using color Doppler. We can directly recognize the femoral nerve by its honeycomb structure on the lateral side from the artery and the vein on the medial side. Remember the mnemonic VAN. Compression of the probe will flatten the vein, as shown here. Continuing to the Saphenous nerve, the most proximal part of this nerve is best investigated with the patient in supine position and the leg slightly externally rotated as shown in this picture. Here we see an anterior view of the thigh. We can see the Saphenous nerve over here. The most important landmarks are the sartorius muscle and its accompanying vascular structures like the genicular artery. Here's the sartorius muscle, and over here is the genicular artery. The Saphenous nerve follows these landmarks until it pierces through the fascia at the level of the knee. In this instruction video, we will start by locating our landmarks. We can see the sartorius muscle with the genicular artery laying underneath it. Here's the sartorius muscle, and there's the genicular artery. The Saphenous nerve is located next to this artery and can be recognized as a rather hyperechogenic structure with a honeycomb appearance. And this is a perfect area for a CSA, a cross-sectional area. If we follow the nerve in caudal direction towards the knee, we can see that it follows the genicular artery along its course. And keeping track of your vascular landmarks can easily be done by using color Doppler mode. And here we see that color Doppler makes quite a difference in finding your landmarks again. Here we see the Saphenous nerve and the genicular artery. After making a cross-sectional area, you will see that the nerve will pierce through the fascia where it proceeds its course subcutaneously. And for scanning the Saphenous nerve in the lower leg, after it pierces the fascia, the patient should be in prone position or figure 4 position as shown in this picture. The most important landmark is the great Saphenous vein. Here we see the Saphenous nerve, and here we see the great Saphenous vein. In this instruction video, we see this ultrasound screen again on the left and the probe position on the right. Let's start by locating the great Saphenous vein. This can easily be done by compression with your probe. And let's have a look at that. And we can find our Saphenous nerve lying underneath this vein. And also here, this is a perfect place for a cross-sectional area to make. In this last slide, I would like to highlight that landmarks will always lead you the way, and the right positioning of the patient makes scanning a lot easier. In this presentation, I discussed the anatomy and scanning technique of the sciatic, femoral, and saphenous nerve. I want to thank you for your attention, and hopefully you enjoyed it.